Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, so you know that feeling, like in the days leading up to your period.
Oh, yeah.
That sort of familiar sense that things are just changing. Maybe a bit of heaviness, some tenderness. Your breasts just feel a little different.
Sure. So many people experience that.
Exactly. And for so many of us, these breast changes, they just feel like a normal part of that premenstrual time. But what do they really mean? Are they just, an annoying symptom we have to deal with? Or could they actually be telling us something? Maybe something important, something positive even, about our health?
Well, that's a question that hasn't always had a straightforward answer, has it?
Right.
One of the co-authors of the study we're looking at today, Dr. Azita Ghoshtassebi, she pointed out that previous research, it hasn't really pinned down whether these super common breast symptoms are part of something like premenstrual syndrome, which makes them seem potentially abnormal.
Yeah, like a problem.
Exactly. Or if they're simply, to be expected, just a normal part of a healthy cycle. And I mean, that difference, it really matters for both women trying to understand their bodies and for their doctors.
Absolutely, because it's so easy to assume any discomfort means something's off, right? But what if it's actually a sign something's, working correctly?
That's precisely what we're digging into today.
We are unpacking a really fascinating recent study. It looked closely at breast tenderness and swelling in healthy women over quite a long time. And it revealed some pretty surprising things about what's really going on in a normal cycle.
Yeah, we've pulled information from a health news article that first highlighted this research, but we've also gone deep into the actual scientific paper itself. It was published in the journal PLOS1 to really get to the heart of the findings.
Okay, let's jump right in then. What made them decide to do this particular research? Why look at breast symptoms and ovulation specifically?
Well, the researchers basically noted that, breast tenderness, swelling, they're common concerns tied to the menstrual cycle. We know that. But there was this gap in really understanding their specific link to ovulation itself.
Okay.
They wanted to see if there was a difference in breast tenderness depending on whether a cycle was, fully ovulatory, normal ovulation, or if it had what they termed an ovulatory disturbance.
An ovulatory disturbance.
Yeah.
What does that mean exactly?
So that could mean either a short luteal phase, that's the time after ovulation but before your period starts, or maybe no ovulation happened at all in that cycle, an ovulation.
Got it. And here's where it gets really interesting, right? Because they started out thinking something else entirely.
They did. Their initial hypothesis, their starting idea, was actually the opposite of what the data showed them.
So what did they think initially?
They suspected or hypothesized that women might actually experience more intense breast tenderness, or maybe it would last longer in those cycles where ovulation wasn't quite right, where it was disturbed.
Huh. Why did they think that?
Well, they were perhaps thinking it might be linked to lower levels of the hormone progesterone in those less than optimal cycles.
Okay, so they went in with one idea.
And the data told them something completely different.
Yeah.
Yeah.
Wow. Okay, so how did they figure this out? What did the study actually look like? How did they do it?
It was actually a really well-designed study. They followed healthy women for a full year. A whole year.
That's a long time for a study like this.
It is, and they asked them to track their symptoms every single day.
Wow.
It's what's called a prospective longitudinal study. Prospective means tracking things as they happen, not asking later. Longitudinal means over time. And that's a strong approach because it gets around the problem of, trying to remember symptoms weeks or months later, which, let's face it, can be pretty inaccurate.
They weren't recruiting women who were already coming in with period problems or breast pain.
No, exactly. They studied 53 healthy women between 20 and 41 years old who were already having regular cycles. They also made sure participants met certain criteria like specific body mass indexes, being non-smokers, generally healthy, and importantly, they hadn't used hormonal contraception for at least 6 months.
So they were really looking at natural cycle dynamics.
Precisely. And a really crucial step was they actually confirmed that these women were having normal ovulatory cycles before they even officially started the main study period.
Okay, so they had a healthy baseline. And then how did they track whether ovulation was happening normally during that whole study year?
They used a method called quantitative basal temperature analysis. It's considered pretty reliable.
Basal body temperature, right. taking your temperature first thing.
Basically, yes. It involves carefully tracking the woman's temperature right when she wakes up first thing each morning. There's a distinct measurable shift in temperature that happens right after ovulation occurs.
Okay.
And this method, it's been validated against other ways we confirm ovulation, like looking for the luteinizing hormone peak or checking urinary progesterone levels. So it's a good way to tell if and when ovulation happened in each cycle throughout that year.
So every single day, these women were taking their temperature and writing down their symptoms.
Yep. They kept a daily diary, noted things like breast tenderness intensity and also any changes in how their breast size felt compared to usual. They did this every night before bed.
That's dedication from the participants.
It really is. And over the year, they gathered data on 720 cycles across all the women.
720 cycles. That's a mountain of data. And they could figure out the ovulation status for most of those.
That's right. Out of those 720, they could confidently confirm if ovulation happened normally or if there was a disturbance in 694 of them. And interestingly, they found that about 29% of the cycles, nearly a third, even in this group of healthy women who started out with normal cycles, actually showed some kind of ovulatory disturbance during the year.
That's interesting in itself, even in healthy, regular women.
It is. It shows that things can fluctuate.
So how did they, measure the breast symptoms from the diaries, put numbers on them?
They used a pretty simple scale for tenderness. 0 meant no tenderness at all, and it went up to 4, which meant very intense tenderness.
Okay.
They also calculated a total breast tenderness score for each cycle. They did that by multiplying the intensity level by the number of days the woman reported feeling it.
Ah, so it captures duration and intensity.
Exactly. And for breast size, they used a similar 5-point scale to track changes compared to how the woman usually felt her breasts were.
Okay, so they've got this incredibly detailed daily record. Symptoms matched up with confirmed ovulation status, cycle after cycle in healthy women. What was the big reveal? What did all this data show?
Well, first off, across all those hundreds of cycles, the average breast tenderness intensity was actually quite mild. It was around 1.4 on that 0 to 4 scale, so generally not severe.
Okay, that's good to know.
But here's a really key finding. All the breast tenderness and all the swelling the women reported, it happened only during the luteal phase.
Only after ovulation.
Only after ovulation and before the next period started. There was absolutely 0 tenderness or swelling reported during the follicular phase. That's the time before ovulation.
Wow, okay, so the timing is strictly post-ovulation. That alone is important info.
Hugely important. And then comes the really surprising part. The finding that, as we said, went completely against their initial hypothesis.
The counterintuitive bit.
Exactly. When they compared all the cycles with normal ovulation to all the cycles that had those ovulatory disturbances across the whole group, they found significantly higher levels of breast tenderness.
Higher tenderness in the normal cycles.
Yes. Higher intensity, longer duration, and a higher overall breast tenderness score in the cycles that had perfectly normal ovulation.
Wait, get that straight.
Yeah.
More breast tenderness actually correlated with better, more normal ovulation? That feels completely upside down.
It does, doesn't it? The average total tenderness score, remember that intensity times days calculation, it was 6.0 in the normally ovulatory cycles compared to just 3.0 in the cycles with disturbances.
Double.
Pretty much. And it was the same pattern for breast size changes. The number of days women reported breast enlargement was also significantly greater in the normally ovulatory cycles. It was about 5 days on average compared to only 3 days in the disturbed cycles.
That is a really striking difference. Did that pattern hold up when they looked within individual women? Like if one woman had both types of cycles during the year?
Good question. They did do that analysis, what they called the within-woman comparison. They looked just at the 47 women who experienced both normally ovulatory cycles and cycles with disturbances over the study year.
Okay, comparing apples to apples within the same person.
Yeah, right. And in that specific comparison, the intensity of tenderness and the overall score didn't actually show a statistically significant difference between her normal and disturbed cycles. So the difference wasn't quite as strong when looking at just one woman's variations.
Okay. So maybe more variability person to person there.
Possibly. However, the duration of breast swelling, how many days it lasted, was still significantly greater in her normally ovulatory cycles compared to her disturbed ones, even in that within-woman analysis.
Interesting. So the length of time the swelling lasts seems like a more consistent marker of healthy ovulation, even within one person's experience month to month. And what about the timing? When did it happen within the luteal phase?
The timing was very similar for both tenderness and swelling in those ovulatory cycles. Both symptoms tended to peak in the late luteal phase.
So right before the period starts.
Exactly, just before menstruation began. And the principal investigator, Dr. Geraldine Pryor, she commented on this, saying they really were surprised to see women reporting more breast tenderness and swelling when ovulation was normal compared to when it was disturbed.
You can see why.
And the lead researcher, Dr. Mary Wood, she basically summarized it by saying their year-long evaluation showed that some minimal breast swelling and tenderness usually occurred before flow in these regular ovulatory cycles in healthy women.
Okay. So let's bring this back to you, the person listening right now. This finding is surprising, maybe even a relief for some.
Yeah.
What does it mean for your own experience with your cycle?
I think the biggest takeaway, the main message here, is that those mild breast changes, that bit of tenderness, maybe some swelling that you might notice in the days leading up to your period, if it's happening within the context of a generally regular cycle, it shouldn't necessarily be seen as a problem.
Not a symptom of something like PMS that needs fixing.
Potentially not. This research strongly suggests that these symptoms actually appear to be an expected, even normal part of a healthy ovulatory cycle. It kind of flips the script, doesn't it?
It really does. From viewing these feelings negatively to maybe seeing them as a sign of healthy ovarian function.
That seems to be what the data points towards. And that's incredibly valuable information, providing real clarity for women and also for clinicians. It suggests if you're having mild luteal phase breast symptoms, chances are it's just your body doing its normal thing, driven by that healthy ovulation process.
Yeah, that reframing is powerful.
And it also subtly underlines something else they noticed in the study, remember?
The disturbances, even in healthy women.
Exactly. Even women who seem to have regular month-apart cycles can sometimes have cycles with ovulatory disturbances. Almost a third of the cycles in this study showed some kind of disturbance, even though they started with screened, healthy, ovulatory women. So regular on the calendar doesn't always mean perfectly ovulatory every single time.
That's a really important point, too. So is there a biological reason why normal ovulation might actually lead to more noticeable symptoms compared to a disturbed cycle? Did they speculate on that?
They did. The study points towards a potential explanation involving the hormonal shifts, specifically the balance between estradiol and progesterone.
The two main female hormones in the cycle.
Right. Both of them rise significantly in a healthy luteal phase after ovulation. The paper actually referenced some previous data showing that cycles without ovulation have dramatically lower progesterone, like 84% lower.
Wow, huge drop.
But estradiol, while lower, is only moderately decreased, maybe around 20% lower compared to ovulatory cycles.
Okay, so progesterone really taints without ovulation, but estradiol dips less dramatically. How does that relate to breast symptoms?
So the research proposed that in those normally ovulatory cycles, you get this robust rise and then fall of both hormones, but particularly that big surge and influence of progesterone, which is largely missing if ovulation doesn't happen. Even though cycles with disturbances might still have a decent amount of estradiol floating around, they lack that full progesterone effect. And it might be this difference in the overall hormonal milieu, the interplay, the levels, the timing of both hormones, that somehow leads to less noticeable breast changes compared to the more complete hormonal dance that happens in a fully healthy ovulatory cycle.
So maybe it's that full, strong cycle of both hormones that primes the breast tissue more noticeably.
That seems to be the idea. The paper also mentions the known physical changes that happen in breast tissue during the luteal phase, things like some fluid retention, increased blood flow, maybe some growth in the milk ducts and glands, all driven by these hormones. These tissue changes likely explain the feelings of swelling and tenderness.
Okay, that makes sense physiologically.
And perhaps the longer or stronger exposure to progesterone, in particular in those normal ovulatory cycles, leads to more pronounced versions of these temporary tissue changes.
So it's maybe less about just having high hormone levels overall and more about the specific pattern and robustness of the whole cycle, especially progesterone's strong presence after ovulation.
That seems to be the thinking, yeah. They also briefly looked at whether you could use breast symptoms to sort of predict or identify cycles with those subtle ovulatory disturbances.
Like, could feeling fewer symptoms be a clue?
Potentially, but since the symptoms were generally less prominent in those disturbed cycles, it doesn't seem like breast symptoms are going to be a super strong, direct indicator of an ovulatory disturbance for an individual woman trying to track things. But still, just knowing that the symptoms are linked to ovulation provides really valuable insight.
Definitely. Now, this was, as you said, a really strong study in many ways to length the daily data. But like all research, it wasn't perfect. What were the main limitations we should keep in mind?
Yeah, acknowledging limitations is always important for context. One thing the researchers noted themselves is that this was technically a secondary analysis. The data was originally collected quite a while ago, back in the 90s actually. For a different primary purpose, they were originally looking at spinal bone changes over the cycle.
Oh, interesting. So the breast symptom data was collected then, but analyzed more recently for this question.
Exactly. And probably the most significant limitation, thinking about their hormonal explanation, was the lack of direct daily hormone measurements like blood or saliva tests for estradiol and progesterone in this specific study cohort.
Ah, so they couldn't directly correlate the daily symptoms with daily hormone levels in these women.
Right. That would have been the ideal scenario to really nail down the proposed hormonal mechanism. But they mentioned that at the time the data was collected, funding constraints and just the sheer burden on participants of collecting daily hormone samples for a whole year made it prohibitive.
Understandable. Anything else?
They also had a relatively small number of cycles where there was absolutely no ovulation true anovulatory cycles, only 18 out of the 700 plus.
Okay, that's not many.
No, and that likely limited their statistical power to show significant differences specifically related only to anovulation compared to cycles with just a short luteal phase, or to see clear within-woman differences just for anovulatory cycles alone.
Right. Those are definitely points to consider when interpreting the results. But on the flip side, the study clearly had some major strengths that make the findings really compelling, yeah?
Oh, absolutely. The strengths are significant. The fact that the data was collected prospectively, tracking forward in time, using those daily diaries over a full year, that's huge.
We talked about avoiding recall bias.
Exactly. It dramatically reduces the chance of women just misremembering symptoms weeks or months later, which is a really common issue in retrospective studies asking people to look back. And the duration itself, averaging over a year per woman, gives a much richer, more comprehensive picture of cycle variability compared to studies that might only look at 1 or 2 cycles.
Yeah, capturing that natural variation is key. And the ovulation tracking.
Using that validated quantitative basal temperature analysis for every single cycle was another major strength. It provided a much more reliable way to confirm whether ovulation actually occurred compared to studies that might just rely on cycle length assumptions or participant self-reports.
It gives the findings a solid foundation.
It does. And finally, the participants themselves were a strength. Focusing on healthy women just living their lives in the community, rather than recruiting patients already seeking help for problems, makes the findings potentially more generalizable, more representative of a typical experience. Plus, as we mentioned, screening them beforehand to ensure they were initially cycling and ovulating normally provided a really solid, healthy baseline to observe changes from.
Okay, so wrapping up this deep dive then. This really careful, year-long study in healthy women offers us a pretty powerful new way to think about common premenstrual breast symptoms. It strongly suggests that mild breast tenderness and maybe some swelling in those days before your period aren't just common. They actually seem to be an expected feature of healthy cycles where ovulation is happening normally.
Right, and significantly, these symptoms were completely absent before ovulation occurred in the cycle, only showing up in that luteal phase.
And the researchers tied it back to those likely physical changes happening in the breast tissue itself during that phase. The fluid shifts, the cell activity, all driven by the natural hormonal fluctuations, which probably explains the sensations of swelling and tenderness. And maybe why they're more noticeable when that hormonal cycle is running strong and complete.
It really does encourage a shift in perspective. Instead of automatically meeting these feelings with worry or annoyance, this research suggests they can actually be seen as indicators of your body's healthy rhythm and function, a sign that things are working as they should.
Okay, so here's a final thought to leave you with. Given this research suggesting that these mild breast symptoms are so closely tied to healthy ovulation, how might paying closer attention to these maybe subtle cues actually help you feel more connected to and informed about your own body's monthly rhythm? And maybe if you're stepping back even further, what does this tell us about the potential for even seemingly small, everyday physical changes that we experience to reflect really significant physiological events happening deep inside us?
Thanks for tuning in to the Health Headliner podcast by To Do Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.